Hi everybody, so I'm Dr. Penny Upton. I'm an Associate Professor at the University of Canberra in Australia, and I'm really pleased to be with you today, even if it is virtually. I'm just going to spend a few minutes talking about the sort of psychological consequences of living with a venous ulcer and what we can do about that, how we can address that in a clinical setting. So it's pretty obvious to everybody that somebody with a venous ulcer has a clear physical problem. They may have a lot of pain. They will perhaps experience exudate and odour, and they're going to be undergoing some treatment as well. And the treatment itself might be quite painful too. So all of these experiences of living with a wound tend to result in a very specific set of psychological consequences. And we tend to see similar sorts of consequences throughout cultures, although the manifestation of those experiences might be slightly different. But what we tend to see is that people will have problems with depression and anxiety, so their mood will be affected because of the experience of having the wound and the treatment and all the other things associated with having that wound. They might feel that they're being stigmatized because they may be very aware of the dressing that they have. It may mean that they have to wear different clothing to cover that dressing up. They may also think that other people can smell their wound, or that other people know that they've got this lesion. And that can really affect your body image as well as making you feel down and depressed. And what we often see is, well, whether there is actual real stigma or not, or whether people just think that others are treating them differently, this kind of feelings can lead to people actually withdrawing from others and spending more time alone, so they become isolated. It may also be that other people spend less time with them because they think that person wants to be left alone, doesn't want to be bothered. And altogether, all these sorts of things that you see happening can really impact on somebody's sense of self, and they start to feel as if they're not who they usually are. They start to feel very different, and that can be quite a difficult thing to cope with. And I don't think we should ever underestimate the problems of that kind of experience. Now, what's interesting, however, is that even that people with very similar kinds of wounds and very similar severity of ulcer will experience all these things differently, and some people will be more affected by the psychological consequences than others. And the reason for this is, we think, the fact that some people, everybody has some protective personal resources, and some people have more of those resources than others. Now, there are all sorts of things like people's ability to cope with having a wound, and we find that people who are active copers do much better. People who seem to be quite resilient and positive in their outlook, so they're very strengths-based, they have hope and optimism for the future. And also we find people who've got good social support networks around them, whether that's friends or relatives or even the healthcare professionals as well. There's also an indication that sometimes people's personality might influence how they cope with having an ulcer and the sort of psychological problems that they might have. And we know that personality, it's not to do with having a specific personality trait, but actually people who are less neurotic, so they're less emotionally affected by things, tend to do better. So what can we do as clinicians? How can we make sure that people who have ulcers still manage to cope psychologically as well as physically? Well, what I should do, since we haven't got very much time to address this, I'm going to say it's really important that as a clinician, you have to address the psychosocial aspects of living with a venous wound. You have to try and bolster those personal resources I've just talked about, instill resilience in people, support them to be less neurotic and more conscientious, because we know people who have more traits of conscientiousness tend to do better. And to do that, it means you have to be very aware of their psychosocial well-being as well as their physical health. And obviously you can, in a clinical setting, ask people how they are, but we know that when you ask someone, how are you today, they tend to give the standard response of, I'm okay, even if we know they probably aren't. And if you really want to assess their psychological health, you need to use a sort of standardized measure, what we call a patient-reported outcome measure, because these measure the dimensions of health that only patients can really know. And it's really important that you choose the right one as well, so that you're measuring not just the problems that people are having, but also the resources they have. So you have that balanced view of what's happening in their life and how they're going to be able to cope. And so to give you an example, as I say, you want something that's going to be measuring the positives and the psychological resources, as well as those difficulties that people are having. And this is just one example of the kind of measure you might want to look at, which is something we developed a few years ago and does tap into both of those matters. And if you do that, it puts you in a good place to really manage strengths-based, holistic, person-centered care for the individual with a venous wound. And it's really important that you're providing hope for that person, but also being realistic and honest. But not just leaving them hanging, if you like, and saying, well, I'm sorry, you're just going to have to live with it, there's nothing we can do, but actually trying to reframe their thinking around things and help them find positive ways forward, and to be independent and take control of their health care. And the really good way to do that is obviously collaborating with the person as you're planning their treatment, and also focusing on what they can do. So rather than taking that deficit approach of, oh, you're not going to be able to do this ever again, is thinking, what are the positives that you can find in their situation? What can they do either alone or with others? And I think celebrating successes and encouraging those positive feelings of self-efficacy, of I can do, are going to be really important for people. And if you're able to do that in a clinical setting, then I think you're going to be in a really good situation to address those psychological and social issues, as well as the physical issues of living with a venous ulcer. Thank you.